Your Excellency, you also construct a modern drugs manufacturing unit at the Drugs and Medical Consumables Management Agency, DMA, which everyone can see is also 100% completion. Your Excellency, you also construct a state primary healthcare board and state contributory healthcare management agency, Zamfara, which is ongoing reconstruction of King Fahad Women and Children Hospital and BBF Center, among others. The Drugs and Medical Consumables Management Agency, DMA, has also capitalized 147 primary healthcare centers and secondary school facilities with sustainable drug supply system, SDSS drugs in the state. Your Excellency, today we are also witnessing the commissioning and distribution of drugs donated by MAV International USA in the Zamfara state. And health management information, HMIS tools, which you have already procured long time ago. They are also here in the custody of Drugs Management Agency, which you also commission the distribution to all the facilities we have in the state. Your Excellency, distinguished ladies and gentlemen, as we are all aware, His Excellency has traveled abroad to advocate for support. United States of America is among countries visited by His Excellency, and the result of that effort is what we are witnessing here today. His Excellency has also constituted a committee comprising my humble self, my permanent secretary, and His Royal Highness the Emir of Bubudu to facilitate the clearance of these commodities worth millions of naira. Your Excellency, the HMIS tools have been procured and ready for distribution to our health facilities, as I earlier mentioned. Before I conclude my speech, I would like to thank His Excellency for procuring decisive ambulances for the parallel services in our primary healthcare centers and new equipped ambulances for all our secondary school health facilities in the state. At this juncture, I want to use this medium to call on the staff working with the State Ministry of Health to justify love, care given by His Excellency to utilize commodities appropriately, and for the community, especially traditional rulers, to also monitor the proper utilization of these commodities in our health facilities when distributed. Your Excellency, as I always said, we at the Ministry of Health, sincerely speaking, we cannot thank you enough. It was only Allah, in His infinite mercy, can thank you greatly and reward you adequately. Thank you very much. Wassalamu alaikum.
The hospital ends of the state. Your Excellency, sir.
I begin by expressing gratitude to Almighty Allah for granting us the opportunity to gather here to flag off the distribution of pharmaceuticals to our general hospitals and the new primary health care centers constructed by my administration in the 14 local government areas. We have constructed 147 primary health centers one in each and every ward in the local government and in the state. This event is part of our administration ongoing effort to support our people in all facets of their lives in consideration of enormous importance. My administration attached to the issue of health. We have taken decisive steps since May 2019 to revamp the health sector to meet the healthcare needs of our growing population, the majority of whom falls into these less privileged categories. Some of the key achievements recorded within such a short span of time by my administration in the health sector includes the establishment of the Zamfara State Contributory Healthcare Management Agency to ensure broader health coverage and to assist in lessening the obstacles our people face in operation for both public and private healthcare sector. We equally launched a program named Care for 34,000 vulnerable persons under the Basic Healthcare Provision Funds in November 2021. We supply ambulances to our general hospitals, which will give each and every hospital in the state a brand new ambulances in the state. We equally provided rickshaw ambulances to all of the 147 newly constructed primary health care centers. We constructed an infectious disease hospital in Damba. We resuscitated the State Drugs Management Agency such that the agency is able to produce some generic drugs for the use of our people. This is in addition to my administration numerous interventions and the health project at the peak of the COVID pandemic in 2020. Today we are here flagging up the distribution of the drugs obtained by the state government from the MAP International, which has its headquarters in Atlanta, Georgia, United States of America. I visited the organization's headquarters in September 2021 as part of my drive to secure intervention from donor groups, global governance, institutions, and multilateral organizations. During the visit, I facilitated the signing of a memorandum of understanding with the organization, which include the shipment of 5 pharmaceutical containers within 2 years. Some of the items already shipped and which were now commencing their distribution today include 16,000 asthma inhalers, food supplement for pregnant women, oral rehydration kits, drugs for depression and blood pressure, analgesics, eyeglasses. The value of this item received so far is about 3.2 million US dollars, equivalent to 1.6 billion naira. We also expect to receive another consignment in the next 2 months. This intervention by MAP International is part of the fallout of my official travel outside the country. In the coming months, we hope to receive even more dividend from such international engagement aimed at securing investment in the various sectors of our economy and support from international groups. At this point, I would like to express the appreciation of the state government to the Federal Ministry of Finance, which granted the waiver of all the charges for shipment of the medicaments. We equally express our appreciation to Custom and NAFDA for their facilitation of the clearance of these pharmaceutical items. I equally express our appreciation and we pray to Allah subhanahu wa ta'ala to help them protest on the issue of the insecurity that is bedeviling the state. I assure you that my administration will continue to explore ways to make our people's life better We'll continue to work with both local and international groups to put smile in the faces of our people. Let me warn the hospital officials who are taking delivery of these medicaments, some of which are life-saving, that anyone caught selling these drugs will be apprehended and sanctioned accordingly. The drugs are free. They are meant for our people, most especially the less privileged. With these remarks, it is now my pleasure to plug up the distribution of these pharmaceuticals to the general hospitals and primary health centers across the state. I'll not end this my speech without showing our appreciation to His Royal Highness, the Emir of Bungudu, who facilitated this process. I'm not even alone with some of our people who we met in United States, who some of them are the indigents of Zamfara and Soto State. We therefore thank you, Your Royal Highnesses, for this, and the state is appreciating the effort you made for procuring these drugs. We thank you very much. This is oral rehabilitation for children. All these parts concern a lot of different parts concern. How many parts is that? What's the 6 parts? That means we have 600. We have 6 boxes, so we have 600 parts inside. It's among the package that will be given to you. You shall know how to have it. If you are not a doctor, you shall get a doctor to give a prescription on how to use these drugs. This is a medical glass that plus 1.50 is a medical glass that should be given to those who need these prescriptions. It's not for wearing for every person, but those who have these prescriptions. It's plus 1.50. So it's part of the package that was given to each and every person.